Hello, I'm Lindsay Varner, and today we're going to talk about the link between ADHD and suicide risk. This seemed like a pretty good quote to start with. A person with ADHD has the power of a Ferrari engine, but with bicycle strength brakes. It's the mismatch of engine power to braking capability that causes the problems. Strengthening one's brakes is the name of the game. So, overall, is there a link between ADHD and risk of suicide? Emerging evidence suggests yes, there is a significant link between ADHD and risk of suicide as well as risks of self harm, suicidal thoughts, and attempts compared to neurotypical individuals. This link appears to span different age ranges, from childhood into adolescence and adulthood, and is observed across various populations studied. Specifically, I looked at research studies from Australia, Canada, US, and China. What do the stats say? Well, there's lots of different stats that we looked at here, so I'll just go through them with you. Individuals with ADHD had a 4.83 times higher risk of dying by suicide than the control group. In a study of Canadian adults, 14% of adults with ADHD reported having attempted suicide in their lifetime, compared to only 2.7 of adults without ADHD. 1 in 4 women with ADHD in this sample had attempted suicide. Among adolescent inpatients in the US, the prevalence of suicidal ideation was 25.1% in patients with ADHD versus 10.3% in those without ADHD. Suicide attempts was 8% in patients with ADHD versus 3.9% in those without. The odds of suicidal ideation alone were 107% higher in the ADHD group, and the odds of suicide attempts alone were 53% higher. So, as you can see, based on many different studies, there's a significant risk here. But what about other factors? In a longitudinal study in Australia, an ADHD diagnosis by age 10, with all other factors held constant, the odds of suicidal thought, plan, or attempt at age 14 increased by 11.13 times. The likelihood of self harm at age 14 increased by 25.14 times. After controlling for covariates, age, sex, race, major depression, median household income, adjustment disorders, borderline personality disorders, and a composite of substance use disorders and alcohol abuse dependence, in this adolescent sample, ADHD was still a strong predictor of suicidal ideation/attempt with an odds ratio of 2.18. When adjusting for socio-demographic factors as well as comorbid learning disabilities, results indicated that those with ADHD had 3 times the odds of an attempted suicide. These odds declined but remained significant at approximately 2 times the odds of attempted suicide when further adjustments were made for history of depression and anxiety disorders. Why do they think this link exists? Well, Treese et al. Examined the interpersonal theory of suicide as a mediator of the association between ADHD symptoms and suicide ideation in college students with elevated depressive symptoms. They found that the link between ADHD symptoms and suicidal ideation was significantly explained by perceived burdensomeness and thwarted belongingness, even after accounting for depression, with perceived burdensomeness having a stronger effect than the thwarted belongingness, but both being statistically significant. So, rather than the ADHD symptoms directly increasing suicidality, they posit that it's the downstream effects from things like impulsive behaviors leading to difficulty in social situations and being rejected by peers, leading to this perceived burdensomeness. Now, while this relationship is not explicitly discussed in any of the articles on ADHD and suicidality that I found, I think that this next little section here is really important when considering acquired capability. So, a meta analysis on the effect of ADHD on injuries found that those with ADHD are nearly 2 times more likely to be injured. Children, adolescents, and adults with ADHD are all at higher risk of various types of mostly unintentional injuries. Some of these that they looked at were things like burns, fractures, dental trauma, and traffic injuries. And they attribute this large increase in injuries to risk taking behaviors, loss of concentration, and hyperactivity, which, once again, I think that it's not necessarily those things individually, but more of the downstream effects from those things that can lead to that possible acquired capability. There are, of course, additional risk factors that compound the risk with ADHD. Some sources suggest that there are actually specific subtypes that may carry different risks, with evidence indicating that the combined type of ADHD poses the highest risk, followed by the predominantly inattentive presentation. We also know that the presence of comorbidities like depression, anxiety, substance use disorders, bipolar disorder, schizophrenia personality disorders, or autism spectrum disorder significantly elevates the suicide risk in individuals with ADHD. One positive thing that I did find, or I guess two positive things that I did find in my research here, is that several studies suggest that long-term methylphenidate treatment has favorable outcomes on many different variables, including reduced suicide risk in ADHD individuals. They also found that there's evidence for a possible causal relationship between ADHD and depression, with a greater than 40% reduction in the risk for depression 3 years after ADHD medication commencement. This points to the importance of early identification and treatment of ADHD. In summary, individuals with ADHD face significantly elevated risks of self harm and suicidal behaviors. This heightened risk is influenced by factors including comorbid health conditions, substance use, impulsivity, social difficulties, bullying, and childhood adversities. The association persists even when accounting for many known risk factors, suggesting other influences, possibly including genetic predisposition. Recognizing these risk factors and implementing comprehensive intervention and support strategies is critical for suicide prevention in the ADHD population. With this, given the elevated prevalence of suicidal ideation and attempts among individuals with ADHD, routine screening for suicidality in this population is warranted. Similarly, assessing for ADHD symptoms in adolescents presenting with suicidal behaviors may be an important consideration in clinical evaluations. Thank you all for your time, and here is my reference page and my second reference page. Thanks.